It's your turn to help them now. We're here to show you how.
It's pretty typical nowadays for adults to be taking many medications. It's not unusual for you to see that your parent's bedside table is covered with 20 or sometimes 30 different medications. That's a problem. And it's a problem that we in medicine call polypharmacy. The reason it's a problem is because nobody has ever tested that many medications together. As a matter of fact, very few people have ever tested more than 3 medications together. And while medicines have extended our lives considerably, in many cases almost doubling our lifespans, the interactions between the medications can cause real problems. One of the things that can be an issue also is the fact that as we age and our kidneys and livers are not processing medications as efficiently as they used to, we can accumulate higher and higher levels of those medications, which can become toxic. One of the things I do when I take on a new patient, and I encourage you to do this with your doctors, is take every medicine in the house, include herbal preparations, vitamins, prescription medicines, everything. Put it all in a big paper bag and bring it to the doctor's office. That way we can do what we affectionately call a paper bag scan. We take out all the medicines, we organize them, we look at all of them, and then we decide with the reverse parenter and the parent what medicines are truly necessary to improve the quality of the life of the patient. There's a lot of medicines, for example statins, that do reduce heart disease, but that take years and years to have any effect. If somebody's lifespan is less than 5 years, does it really make sense to continue a medication that's going to reduce their heart attacks and heart disease in 10 years? We also want to remove all the medications that can interact with one another. It's not uncommon to be on medications, for example, that make you feel drowsy, or make it difficult for you to think, or make you more likely to fall over and injure yourself. It's important to make sure that those medications are eliminated or reduced or narrowed down to the ones that give the best benefit, and eliminate the ones that are complicating issues. There are also a lot of supplements, vitamins, herbs, minerals, which people think are doing them well. But the bottom line is that those are chemicals. It doesn't matter what it says on the label, if it says it's natural or organic. They're chemicals, and they can interact with each other, and they can interact with other medicines. And they too can cause ill effect. So we need to look at all of them. We need to eliminate the ones that are unnecessary. And we need to make sure that we are doing good without doing harm. Good geriatricians are often able to eliminate 80% of the medicines. It is not unusual for me to start out with 20 medications and eliminate them to about 4 or 5. And it is also not unusual to find that the patients wake up, become more alert, become steadier on their feet, and have a better quality of life. Now that's not a guarantee, but it is definitely worth looking at. Let's eliminate polypharmacy.
It's your turn to help them now. We're here to show you how.